presenter, Dr. Kenya Beard.
Thank you so much for that introduction. I am excited to be here today. Allow me to share my screen. It's great to see so many familiar faces. So before I get started, thank you everyone for joining today. I'm excited to be here. I was on a call a few months ago where the speaker asked this question, and I want to pose this question to all of you. So many of us probably have been in a cab before. Right now, Uber is like $1 billion industry. Why is it that a cab driver did not create Uber? They're in cabs all day long. They drive for a living. Why didn't they design it? I was at a conference last week, and my colleague, Dr. Frida Outlaw, heard someone talk about a discriminatory act, and I heard her say, this has been happening generation after generation after generation. And it made me wonder, what are we missing? Why is this still occurring? Is there any similarity to the cab driver who's in it every day and can't think of something innovative like Uber? And we, inside of racism or discriminatory practices, and we can't find our way out of it? What will it take to eliminate discriminatory practices in the workplace? And what currently exists? First, we need to find out, what does retaliation mean? When you think of retaliation, what comes to mind? Anybody, you want to put it in the chat box? What comes to mind when you think of the word retaliation? Thank you, Brian. Brian said he thinks that we're in it and we haven't been able to get out of this system of racism because they're not aware of the system. And when I asked the question about what retaliation means to you, what comes to mind? Tracy, did you want to share something? Nope, okay. When I said what comes to mind when you hear the word retaliation, Benita said payback, and Susan said getting even. Kara said harm, and Kirk said revenge, payback, hitting back, like a whistleblower. So the American Heritage Dictionary defines retaliation as to return like for like, to take revenge, and some of us said the word revenge. And when we think about the word revenge, it means to inflict punishment in return for injury or insult. So is retaliation a real phenomenon? Is it still occurring? So as I'm looking around on the screen, people are shaking their head, yes. So what do you do nowadays if you want to know if something is real? Just Google it. So I Googled retaliation, and guess what popped up? FedEx has to pay $365 million in punitive damages in a racial discrimination and retaliation case filed by an ex-employee, Jennifer Harris. She said she was discriminated against because of her race and was fired as retaliation for her complaints about discrimination. She was asked to take a demotion, which she claimed was discriminatory based on her race, and then she was subsequently written up for her performance and eventually terminated. The next top story. The EEOC has sued a long-term care facility for allowing Black nurses and nursing assistants to be subjected to ongoing and egregious racial harassment. Is it racial discrimination if your patients discriminate against you? Not the hospital, but the patient. And Sarah is like emphatically yes, shaking her head. Absolutely, yes, right? So in this case, the EEOC claims that white patients and residents directed offensive racial slurs, including the N-word, repeatedly even told some of the nurses to go back to Africa. And despite managers witnessing this, the nurses were told that the residents could say whatever they wanted to. No, you can't. Retaliation is a real phenomenon, and the EEOC says employers are not allowed to discriminate against employees based on race. In fact, such alleged conduct actually violates what? Title VII of the Civil Rights Act of 1964. And it prohibits employers from discriminating against employees based on race. So if we have the laws in place and we know that retaliation is a real phenomenon, why is this still occurring? So true or false? The Civil Rights Act of 1964 prohibits retaliation against persons who complain of discrimination or participation in an EEOC investigation. Put in the chat box whether you think that is true or false. And that's true. Between 2009 and 2013, the EEOC in their annual report on the federal workforce, they have claimed that the most frequently alleged basis of discrimination in the federal sector, discriminatory findings, discrimination findings based on a retaliation claim. And that retaliation, they said, outpaced basis of discrimination. So retaliation, there's a law on the books that says you can't do that. And yet, how many of you know or have experienced it yourself? So if this is happening and we have laws on the books and we know that retaliation is discrimination, how does it continue? So the purpose of today is to focus on some of those downstream impacts. What happens when we decide to either leave or stay? And what should we consider before we move forward? So we already talked about the rules. There are plenty of rules. Rules, laws, the EEOC, fair employment. Your institution probably has policies and practices. But many of you on the call said you still see this occurring. Why is that? What do you do when you perceive discrimination? What do you do when you perceive retaliation? Some of us have wrestled with whether or not we should stay or walk away from a place of employment when we've experienced discrimination. If you decide to walk away, should we care? How are we stopping this cycle? What are we doing differently? What do we expect this generation to do differently? So we're not in any way preventing ourselves, our discipline, from getting better. And I know that's a difficult question because sometimes we feel like we have to do things individually, and we should be looking at this from a systems perspective. So if we have rules that forbid unlawful discrimination, can someone tell us how it still occurs? Anybody? You want to come off of mute? You can put it in the chat box. We have rules that forbid unlawful discrimination, race discrimination. Kara said, well, it's hard to prove. Specifically, what is the employee's recourse when a patient says, I don't want a blank caring for me? So that's a great question because we've heard it before. And what is the recourse? The institution has to have a policy. And if they don't, legal needs to come up with a policy on how to respond. Because if the managers don't know how to respond to it and they allow it to continue, and the employee is talking about it, that's racial discrimination. And you could win a lawsuit. But many of us on this call might be thinking, I didn't come to work, show up to work to have to file a lawsuit. Sarah, I see your hand up.
Yes, I have seen that it's a personal thing in the way that it depends on the personal situation that the person who is being discriminated against is in. So you mentioned something just a little bit earlier about doing it as a group as opposed to an individual. But I think it also has to be planned, because your finances have to be in order. Your household has to be in order. If you are a single parent or you are taking care of older parents or what have you, you may not be able to afford to be able to lose your job because you're living from one month to the next. So you can't miss a paycheck. And I think that has something to do with some of it. It needs to be planned, possibly in a group, and you have to prepare for it if you're going to do something about it.
Thank you, Sarah. So Sarah brings up a great point. Individuals have a lot at stake when they're trying to challenge something individually. And to her point, a person might feel that the retaliation might result in them losing their job, and they might not be financially able to do that. That lawsuit with FedEx took over a year. So others are saying not everyone knows the rules and the laws, unfortunately. Someone said microaggressions, sometimes it's subtle in nature, the rules are not enforced. A social norm, it is not reported because it's not enforced. Keisha said culture eats policy for breakfast, don't let us forget that. And you didn't show up to be mistreated either. Thank you, Crystal. So Tammy said, do you think a group will stand up and stay together or buckle under the pressure? Tammy, do you want to expound on that? And Brian said, while we're waiting for Tammy's response, specifically if you are out of the country. And Robin said it depends on the group. Well, yes, yes, and yes. When we think about the laws that we have, and if we have laws, how does it still occur? Because we know laws and policies address the actions on a macro level, on an explicit level. And what happens sometimes is that the actions are less explicit. So the ways in which the rules get operationalized hinges on numerous factors, all the factors you just listed. So we know policies and laws are never enough. It's a start. It is definitely a start, but it's not enough because policies and laws need people to operationalize them. And the reality is, when anti-retaliation policies exist, that's great, but you need individuals to uphold the law. And several of you said that. Some of the factors that are more likely to influence retaliation are the absence of policies that discourage retaliation. So where is it in your performance evaluation? Because if I'm not looking for it, if I'm not measuring it, it's probably not going to happen. So we saw the realities, you shared some of the realities, and the fact that not all institutions may have this. So there was an article that appeared a couple of months ago, and it said, people don't quit jobs, they quit bad bosses. Consider the last time you left a job or you talked to someone who said they were leaving due to racism. What's the one word that best describes their main reason for leaving? And while you're typing that in, thank you, Lillian, for the Benjamin Franklin quote, justice will not be served until those who are unaffected are as outraged as those who are. Yeah. Silence, well-being, left because of underappreciation, left because of the culture. unsupported, or stressed. Crushed spirit. Yeah. Done. No hope. Insignificant. Yeah. Tired of unfairness. So when people leave, do they necessarily create or write a letter stating the real reason why they're leaving? Keisha, I see you saying no. You want to come off of mute and share, why do you think that is?
Hi, thank you. I think retaliation. I think people feel like, I know in the nursing world, how many times I've heard that it's very small, and if you do or say something in one organization, it gets spread into the organization. And unfortunately, you're judged by someone not really knowing you about your character. So yeah, no, they quietly walk out and don't tell the whole story, fearful of retaliation, or saying when they're going to the job for reference, a good reference.
Yeah. Spot on, Keisha. Thank you. Kelly said, people don't want to burn bridges. Brian said, exit interviews is stuff they did not even read it. Exit interviews stuff, they do not even read it. And Tammy said, doesn't make a difference. So Rashida said, some people are exhausted with the second questioning and the guess. So if the system is not allowed to work, how will it work? Because what we're saying is valid. If people are afraid of retaliation, and retaliation is what helps to stop or turn the course, or maybe retaliation is, the laws against retaliation is not strong enough to turn the tide. And if that's the case, then what will do it? I want to share a couple of articles. My colleague and I, Dr. Renitha Julian, we conducted a qualitative study to explore this very question: is race a factor? And one faculty member believed that efforts to disrupt the status quo, it did nothing. It was met with resistance and excuses. And when we think about Isabel Wilkerson's quote, she wrote the New York Times bestseller, Caste. She said, sometimes when we think about inequities, racism, she says it's cast in the guise of normalcy, injustice looking just, atrocities looking unavoidable, to keep the machinery humming. Is that what's actually happening? Because the machinery keeps humming, and the machinery is code for racism and discrimination. Injustices looking just. And then when I look at the article from Ketchy, Dr. Iheduro Anderson, when she looked at the research from Wilkerson, she looked at the work of Dr. Roberta Waite, she really amplified that nursing leadership dynamics perpetuate racism at times. And then when I look at Dr. Whitfield Harris and others, they highlighted that not much has changed. And I shared that earlier, something that I heard that Dr. Outlaw has shared. Not much has changed. How is that possible when we have laws? Okay, so we already said the laws are at the macro level, right? You're not supposed to go past a stop sign or you'll get a ticket. Many people still go through a stop sign. So what is needed? And then one of my favorites. So Dr. Rumeh Alexander, a leader in social justice, has shared that leaders must do more to recruit and retain nurses who will eventually reflect the diversity of a nation where racially and ethnically minoritized groups will make up the majority of the population by 2043. How do we recruit and retain? When individuals are sharing that they feel neglected as a source of knowledge, that they have experienced covert acts of racism based on skin color, that intellect is typically ascribed based on race, and discriminatory policies and practices still exist. So what should we be considering when deciding to stay or leave? Should the onus be on the individual? And while we're completing that, I'm just going to go back. So Mary said, especially if you work in a small community, being bad-mouthed for someone leaving and going somewhere else, this is what was in response to why people aren't always honest with their exit interviews. And someone said, I think folks need to know that most organizations have a policy to only confirm dates of employment and not to provide references. References should be requested by specific individuals that you trust. Yes, and going back to the point, nursing is small. And people are still afraid that someone might know someone, and no one wants to be labeled as a troublemaker. So the social norms that Robin referenced. And Brian, I was an employee health nurse, and I did document in the employee chart that she discriminated at workplace. That's why he stressed out. So what should we consider? We should consider if HR is supportive and objective with my complaints. High five, then I will stay. Yeah, so where is HR in all of this? Because they truly are the experts. Is it safe at your institution to report discrimination to HR? Because they read the guidelines, they have to make sure and try to mitigate damage, litigation, based on someone saying they feel discriminated against. Robin said both the employee and the organization have to do due diligence to operationalize these policies and the laws. And someone said that I stayed, HR assigned me an outsourced lawyer to investigate. So there are some factors we should consider when we decide whether to stay or leave. Now, one of the big things that's looming over us, and when I say stay or leave, like leave nursing, is the fact that we're already in a shortage. It was just recently declared the nursing shortage was declared a crisis. So we know that the supply of RNs are under threat, but is that enough to make a person want to endure discriminatory practices? So consider this example. 2 faculty members apply for a director's position. Both meet the minimum criteria. However, one candidate is much more qualified. The associate dean meets with the more qualified candidate and informs her that before she gives her the position, she wants to give her a few projects to see if they can work well together. What are your thoughts on this? Before we even answer the question, what are your thoughts? The work should be compensated. Are we both having to do projects? Not a fan of free labor. She has reservations of her abilities and competencies. Projects for an interview equals free labor. So someone else agreed with that comment. And I don't work for free, not equal. Something feels off here. Yeah, and sometimes things feel off and we can't just put our finger on it because, again, it's so nebulous. Both should do the projects if you are deciding. They should both be given the same ask. Making the faculty prove themselves. They should be paid. How long does she have to make the decision? Wondering why. Sharon, I think like that always. I'm always like, why? What's the underlying current? What's fueling this? Because usually we're bright individuals. Usually when we ask something, even a 5-year-old, when they ask for something, they already have something in mind for why they're asking that question. Questions don't just come out of the blue. So if someone says, could we work on some projects together before I decide? There's a reason why that's being asked. And sometimes we just need to ask the question, what's precipitating this? Someone said, yes, if she's more qualified, what's the problem? Agreed. I believe that foreshadows the future work environment. Definitely. I'd be so offended if it's not standardized and communicated what the terms of the interview process is in advance. It's kind of fishy. And someone agreed with you, Dr. Outlaw. And was this a requirement for the position? And was it in writing? What are the expectations? But if she's more qualified, we go back to, then why the ask? And if you do ask and you say, well, this isn't something that's normal, and I'm wondering what's fueling this ask, and then you refuse to do that ask and you're not given the position, is that retaliation? It could be. So what are the options? What are the options? Sometimes we think options are very binary. Do it or don't do it. Stay or leave. But it's more complicated than that. So what are the options? We can consider having both candidates do the projects. We could focus on the qualifications. I have been I was not hired as I was told I was not a good fit. I have not been hired because I was told I was not a good fit. I was not told why I was not a good fit. Yeah. So people in the hiring world know it's usually the 3 things. Can you do the job? Will you do the job? And are you a good fit? And that, are you a good fit? Very subjective. For this specific situation, equality in interviewing process. And I noticed that person specifically said equality, not equity, but equality, meaning they both get the same thing. Thank you, Tammy. Oh, and I love this. Dr. Rooney said, seek to understand, right? That's a proverb. Ask questions if all candidates are receiving the same request. Yeah, but sometimes people feel that when they ask questions, that's not looked upon favorably. Ask why, as you suggested, seek to understand. Yes, like that wording better. I think the key is the work well together. Thank you. And Rachel said, ask what she is looking for from the project. Perhaps you have already done something that can show her that quality she is looking for. I love that response. And it's not even about her ability. Agree, good fit is subjective. So before the interview, the entire panel needs implicit bias training. We need a standardized interview process for all who will make the final round. And we need to have a weighted tool to score the applicants fairly. I remember years ago being asked to go on an interview for a study. And maybe those studies need to come back to see, are we standardizing in nursing our interview process? Or is it still mainly subjective? And we have a colleague who was not chosen, even though she was more qualified. She was told she didn't have the same synergy with the team as the other candidate. And what does that mean? And Sharon said, I hate the word fit. It can be used to mean anything or nothing. It is a hidden message. Fit equals assimilation. And Kendi talks about this as being racist. And Jonas said, somewhere I read recently the idea in hiring, looking for rather than a good fit, a cultural ad. That's the phrase of the day. Thank you, Dr. Peterson, for sharing that. A cultural ad. And we need to define subjective. So when we think about this scenario, the candidate actually withdraws her application, resigns from the institution, applies to a different institution, and is hired to lead the NP program. But what are the potential implications of this response? To what extent does this contribute to the next generation facing the same issues? And again, I'm not saying that a single person has to take this on. What is missing? How do we think like the designers of Uber? How do we think outside the box to correct this assault? What is the innovation that's needed? And Michelle said she loves the cultural ad. So first, we have to be able to have a conversation. And a lot of times when race comes up, people freeze, either because they're afraid to go down that road, or they fear retaliation. They feel it being misunderstood. So the coded language, good fit, synergy, sometimes gets dropped and we just leave. So one of the things we can do is first recognize the opportunity to address racism. The second thing is always restate. You want to restate because you want to seek clarification. I heard you say that you would like to give me projects to see if we work well together. Remove the stigmatized issue away from the person, because we don't want to get into a, I feel this way, you feel this way, I'm right, you're wrong, you're right, I'm wrong. There are a lot of institutions that might believe that you want to see if a person is a good fit. But let's take a second and reflect on the extent to which stereotypes could be contributing to this ask. If we don't ask the question, how do we get the answer? If we don't ask the question, how do we truly move forward, breaking down these barriers to inclusivity? So reflecting is the difficult part. I've tried that many a times. I've had to leave some institutions when it didn't go the way I thought it would have gone. So this is not a panacea, but we do need to get to a place where we feel like we can talk about the elephant in the room. And then to recover. How do we recover? How do we talk about structural racism as a driver of inequities, not individuals, but the system, and how historical beliefs can shape practice? The assumption is, and we've got studies, the articles I've shown you, to support how sometimes the color of one's skin is equated with you wouldn't be a good fit, or you couldn't do this job, or I can't give you this promotion because. And then how do we allow the opportunity to rebuild, to create that sense of inclusivity where we can delegitimize stereotypes and control for bias? What does that look like? Questions? Robin said, unfortunately, folks are uncomfortable with being uncomfortable. So yes, this is uncomfortable, but when a person is told you're not a good fit, that's uncomfortable. Right? And Kara said, restating often allows the other person to sit with the ask, making them recognize what they just said. Because sometimes we don't hear what we say. So the conversation has to be had. How do we have these conversations? How do we normalize these conversations? I don't believe that it should be up to individuals. I believe the system should be asking these questions. As a leader, I should be asked, what are you doing to create an inclusive environment? So you get to the point where, in this scenario, that individual had to decide, am I going to take on this project, or am I going to walk away, or am I going to talk about it? Am I going to work through it? So I saw this article in Forbes early this year, and it had 7 points, and you can agree with some of them and say, well, maybe not. But the first one, I think all of us will agree with: know your purpose. Know your purpose. And then the second thing, are you just burned out? Are you ready to leave? Third, identify what would it take for you to stay? Hopefully, if you had a conversation with HR and you told them that you were thinking about leaving for XYZ reason, you would be so valued, so incredibly valued, that you would be asked, tell us what it would take for you to stay. You should already know before you're asked what it would take. How do you create what you want where you're at? Because if you leave, you have to realize that most likely, I'm not going to say guarantee, but based on the feedback from this conversation, you're going to run into the same situation. So explore your options. Someone said earlier, sometimes people can't just leave. I think Sarah shared that with us. Never quit because you don't get along with someone. I'm going to emphasize that because that's something that my mother taught me. You do not quit because of someone. That's ridiculous. That someone is going to be at the next place with a different name at a different location, but you don't leave because of someone. And then exit with grace. And does exiting with grace mean that we can't be authentic and honest with the reasons why we're leaving? So Sharon said, how can we influence systems to uncover these challenges? Great question, Sharon. And begin the work, at least with engaging leaders. Well, what type of leader will it take to have these courageous conversations? We often talk about humble leaders. It would take some level of humility in order to see a different perspective that's suggesting that you might be doing something that's discriminatory. So, yes, these are some things you could consider when you choose to walk away, but we need a system. We need a system that supports a desire, our vision of diversity, equity, and inclusivity. Because at this point, our nursing profession, our healthcare system, our higher ed, we're not there. How do we get there? where everyone feels that they can share exactly how they feel without the fear of retaliation. Find an ally. If you do wind up leaving, take with you lessons learned. Yes, we always are better for the lessons learned and what you will do differently moving forward. Totally agree. I love that. And on that note, I want to transition us to a scenario where